My full name is Nijil Vasukutty, and I'm presently a consultant orthopedic surgeon based in United Lincolnshire Hospitals. My area of subspecialty interest is foot and ankle surgery. I also have some educational roles within my organization. I am the academic lead for the University of Lincoln for orthopedic specialty, and I'm the Royal College tutor for orthopedics for my hospital, that is Pilgrim Hospital. Like, why did I decide to become a doctor? It's not an easy question because it goes back a long time now. I mean, basically, the way I look at myself is I'm a people person. So I like, interacting with people, talking to people, compared to just, sat at a desk and doing, in front of a computer, like that sort of job. So compared to that, I like meeting people, talking to them, helping them out when they are in a difficult situation. Okay, sometimes some patients you meet them when they are maybe in one of the worst times of their life. So you having an opportunity to help them make their life, even if it's a little bit, make it a bit better. It's a great honor, it's a privilege to do that. I told you my specialty is orthopedics. It's a surgical specialty. So when you go into medicine, at some stage you choose between whether you want to go for a medical specialty or a surgical specialty where you. So I chose quite early in my medical school. I decided that I want to do surgery. I wanted to take up a surgical career. Just because I felt that you're actually going into the root of the problem and you're actually physically doing something to sort the problem out for the patient. It's not that in medicine or physicians do not do anything to sort out the patient, but in surgery you do something tangible, and there are like tangible results to see. It's just me. People have their own views about why they choose their respective specialty, but this is my view. My particular job, especially trauma and orthopedics, what it involves is you treat injuries, you treat painful joints, you correct deformities. So when a patient comes to you with a deformity, say it's a foot deformity, so when you treat them, you see a tangible change, a visible change to them. Similarly, a patient is in pain with arthritis, or a patient is unable to get about due to a fracture. You do something, you get them back to function, you get them back moving. So getting them back moving, getting them back to function, getting them back on your feet, it's very satisfying. From the feedbacks I've got, patients say, I'm a good listener, I'm a patient listener. I just, at least the initial part of the consultation, I just let them talk and I just listen to them. So that is one thing the patients say. And I spend some time talking and explaining to them as well. So that is from the feedback that I got. And what do I like about my patients? One, I learn a lot from them. I learn a lot from the feedback that I get. Whether the outcomes from surgery. So I learn a lot from them, and you feel good when they come back after the operation and they're happy, they thank you, you feel good about it. I've got a mantra, but it's not just mine. It is like an orthopedic sort of mantra. Life is movement and movement is life. That's the mantra I follow.